Let's go on to the next one. I'm going to ask Lisa Babby, who was in this room here to focus on guidelines and best practices.
I don't have to say anything because most of you were in the room, right? No, sorry. All right. We actually this morning spent a lot of time on the vision. And so I thought before I get into the details of the ideas that you produced for how to achieve the vision, that I would try to summarize the visions that I heard this morning. And again, Dan's made this point a few times. I hope I did earlier as well. I probably won't do full justice, but that's what the extra time will be for you to actually complete it. The vision is for Canada as a world leader in patient-centered approaches to diagnostic, treatment, and education related to Lyme disease. This includes patient liaison and advocacy roles, a patient experience that is characterized by respect, transparency, and inclusion, trust in the medical system, timely, accurate, and effective diagnosis and treatment, doctors who are free to diagnose and treat on clinical observations as well as test results, research that includes qualitative and quantitative evidence, recognition and understanding of the evolution of the disease in its acute and chronic aspects, recognition of Lyme disease and its acknowledgement by employers, insurers, and provincial health care plans, and properly funded research. I'm sure there were other elements, but those were the ones that we were able to synthesize in the limited time we had since this morning. And you have here the two flip charts of ideas that came from the groups in terms of what can we do to achieve that vision. I can't do justice to this. I'm not going to make you suffer through reading through all of them. But I did again work with the note takers to try to see if there were some themes that we could pull out and then maybe give a few examples under each of those themes. Before I go there, first of all, there were some common threads. And the most important one, I think, was the real sense of urgency. So even though we tried to do short-term, medium-term, and long-term, a lot of things ended up in short-term, and understandably so. And I also want to recognize that some of the things that were identified for the medium and long-term would probably require some action in the short-term for them to happen. So I kind of dropped the short, medium, and long-term themes from this report, although you can see them there. And you remember towards the end of the conversation, we ended up saying, okay, I'll just write these wherever we can make them fit because it just didn't make sense. Some of these ideas actually overlap with what Alain has already said about surveillance. And there are some things that you talked about that fit into education and awareness that I might not talk about so much. So I'll try to do what I always asked everybody else to do, which is to skip over the pieces that are repetitive. The first kind of theme that we identified was around research and testing. Funding, obviously, money for research. And an interesting idea around that was also, well, let's build the business case. Let's identify, how much money you save from the system by treating people early, treating them well, avoiding all this burden on the health system. How much is it costing them as well, and redirect that money to research. Another idea was properly defining the disease, so the sense that it wasn't properly defined yet. Looking at multiple modes and pathogens, co-infection, and we've talked about that a little bit. Something that hasn't been spoken about in terms of research and testing was the blood supply testing. People with Lyme disease can give blood, and that was a source of concern for a number of you, and you also talked about testing for co-infections, not just Lyme. And then an idea that came in early on as the idea of a center of excellence for research, and maybe combining that with a center for treatment so that you could get patient input right then and there and information about the treatment. And also make sure that this center of excellence is multidisciplinary so that you have all of the disciplines that intervene in the treatment of this complex disease involved in the research. On the physician side, next theme, there are things around education, and I'm sure Kathleen will speak to that at length, so I won't go into that. Allowing them to treat without risk has come up again, and removing the restrictions to prescribing antibiotics. no loss of license. There was mention of a 5-year moratorium, including allied health professionals in the whole definition and involvement of physicians and health professionals in the work on Lyme disease. Removing endemic areas from the guidelines was an idea. Having more thorough reporting on blood tests, not just positive, negative, but somebody talked about the fine print, I think, earlier today or yesterday. Around information, Alain spoke to this at length, so I won't go into it a lot, but there were like 5 or 6 different databases, I think, identified in the conversation that might be helpful, of complaints, of tick observations, of physicians, those that are good and those that are not so good, of symptoms and of treatment outcomes. So, this thirst for information and for good management of information so that you can do things with it. And then the international sharing of knowledge and best practices was raised as an idea. On the patient side, reimbursement of past expenses was requested, changes to the laws, the revision of healthcare acts so that people can actually access care more easily and without having to pay out of pocket, an online helpline for people suffering from Lyme disease or suspecting that they've been infected with Lyme disease, having Canadian doctors allowed to talk to the US doctors when they're treating the same patient so that they can share information and move things forward. Regular annual conferences to engage patients and this came as part of a comment on the evolution of the tone in this room from when you first arrived and all of the sadness to the sense of hope that seems to be emerging here. And the opportunity to speak with each other and to build your support networks and how helpful that was to you. There were a number of mentions around the psychological and psychiatric dimensions as well and things that might be done there. Comments around, remember that this could be a somatopsychic as opposed to psychosomatic, so physical symptoms causing psychological problems. Is Lyme maybe something that needs to be considered as a precursor to suicide? And obviously the holistic approach coming back again here. Other comments I'm going to summarize, and again, things that might not have fallen cleanly into these other themes, but I'm trying to give you as many diverse examples and cover the ground as best I can, making sure that there's an evaluation component in the framework so that you plan for evaluation. There were recommendations that dealt with the Canadian Medical Association or provincial governments that the federal framework might not be able to do anything about, but the message might get out to them. Medical colleges was another one, that they be centers of innovation, not only control and monitoring. There were ideas around eradicating ticks, better protection against the ticks, and then, as I mentioned, education and teacher materials around prevention, but also around supporting children suffering with Lyme disease, which again, I'm sure that Kathleen will speak to. I'm going to stop it here. I could go on for days.
Okay, same procedure. Let's start in here. We'll invite our WebEx colleagues to queue up as well. Questions, not questions, but anything to add? Ideas that have not been heard so far? Let's start over here.
While I was at the hospital, a patient came in with a cat bite. The attending physician said to him, as a prevention, I'm going to start you on 2 weeks worth of antibiotics, IV, as a prevention. Because for Bartonella, he didn't have the test, they did it as a prevention. Perhaps maybe we need to adopt that if we show up at the hospital.
Okay, thank you very much. Other ideas? We'll hear from Jim.
Thank you. I was going to bring this up in my closing remarks, but there's been such good, robust discussion here. I think I can eliminate it and shorten things up here. Positive way to make change, and especially in the improvement of diagnostics, is to really start protecting our doctors. Well, one step that can be put in place is that there be put measures in place to immediately monitor the frequency with which doctors are policed by colleges of physicians and surgeons simply for treating Lyme disease. Currently, Canada approaches about 100% of these doctors being investigated, but often the CPA, the College of Physicians and Surgeons, they come in under the guise of other reasons. But yet the overall investigation rate of physicians being investigated is less than 2%. So we're approaching 100% with Canadian doctors who treat Lyme when it's less than 2% overall. So that's clearly discrimination. One way to fix it would be to put for our federal treasury to stop some of your and my federal tax dollars from being doled out to each year to provinces who do not specifically have a mechanism in place to protect doctors from this discrimination, with effective oversight outside of the medical system. Also, on the other aspect for guidelines, you can't have good guidelines and diagnostics if good ethical science isn't done. Mm-hmm. And currently there seems to be two standards of ethics in Canada. All of our universities have very, very long-standing rules of ethics in place about research, especially regarding withholding data that showed a result that could affect a person or a population, regardless of whether they're sure or unsure as to how to interpret that data. Okay. If it's shown that it may have an effect, it's got to be reported to the doctor or to that group. Right now, our federally and provincially funded scientists don't seem that they have to act to those ethical standards. We've got to hold them to that ethical standard, or else we are not getting the right information to our physicians and to the public. There's a lot of data that is being sat on right now in each of our provincial laboratories and our federal laboratory that is not getting back to the physicians and to the public, that needs to get out there. For example, we've been asking for years to get simply banding data from Western blots that have been run on all of us over the last several years. We don't want your personal information. We want that all stripped out. We just want the banding data. And we have had roadblock after roadblock put up, and excuse after excuse. In fact, at one point we were told, oh, we didn't see the value of it, so you're not getting it, or we didn't think you needed it. Well, that's not your decision. This is public data that needs to get out there to be evaluated.
So you're looking for open access, Jim?
Absolutely open and transparent.
All right.
And proper ethics applied.
Okay, thank you. Point noted. All right, there's a mic that's traveling up here.
One comment was that rather than disability be rather than like it's all or nothing, so have like a part-time disability for those that can work only part-time during the week rather than a full-time, and have it based on functionality, not on the, what was the word that we used? Sorry? Not on diagnosis, sorry. And the other thing with the, along with the blood supply, also I've always thought about organ donation and how that should be thought of when it's being asked if you want to be an organ donor. I don't think any of us should be given our organs, and that should be considered as well.
Okay, thank you for that point. Mike to the back. Anyone else? Go ahead.
I think it's absolutely amazing what we've done here, and I want to make sure that we don't lose this work. So I think we need to have a process of accountability with this federal framework. And considering the fact that after the framework's published, I believe it's 6 months that the provincial health regions have to come up with their own standards. I would like to see in 2 years having a follow-up to the federal framework where we gather here again, that the health ministers are there and we're saying, what have we done? Have we accomplished our objectives? And to actually tie some of those federal transfer payments to the results, making sure that the results are in line with the framework. And if you tie money to it, it will happen.
Okay, thanks for that. Hang on for 1 second. Let me go to the WebEx folks first. Do you have anything to contribute?
Thank you. From Carolyn Lennox, please go ahead.
Okay, go ahead.
Hi, thank you. Yeah, I just want to kind of follow up with what our facilitator presented. A few of us are chatting on Facebook together, and we don't recall, or we didn't hear being said that we wanted all the funds redirected to research. We want treatment too. And also that protection for doctors also includes protection for parents who are forced to treat in secret and who get accused of men chosen by proxy. So thank you for that.
Thank you. Overflow room, question please, or your idea for input.
Yes, Michel Savant, advocate. Regarding holistic care, we made allusion to it a few minutes ago. We talked this morning about certified naturopaths and MDs working together. We want to have that facilitated, encouraged, and we also talked about naturopaths. In some parts of Canada, they can prescribe. Other parts of Canada, they can't. And of course, in other parts of Canada, they don't have to be certified. So we would like to see some kind of a holistic approach be encouraged and facilitated. Many of us might be seeing a naturopath and an MD, and often they do not have the opportunity to work together. We want to see, I'd like to see that happen more often, facilitated, encouraged, and of course, in some cases, simply, yes, that's what I want to say.
Thank you. Appreciate that input. Let's go to WebEx participants.
Thank you. Our next participant is from Elaine Gagnon. Please go ahead.
Allez-y, go ahead.
Thank you. Can you hear me?
You'll have to speak as close as you can to the microphone because you're...
Is this better?
Yep, keep going.
Okay, I just wanted to expand on the importance for having the conference annually. It's not just an area for us to get support, but it's also a forum that we can keep updated on new research, whether or not our treatment is helping, whether or not we're able to get effective treatment, and whether or not further education is needed. Thanks.
Good, thank you for that. All right, anyone else on WebEx? We'll take one more person.
Thank you. Our next participant is from Kelly Jensen. Please go ahead.
Thank you, go ahead.
Hi, my points kind of revolve all under 3 sessions that were made, but I'd like to, the fact that congenital Lyme be addressed as well as a sexual transmitted infection. Secondly, I like the testing to be considered for other organisms to transmit the disease. I myself was bit by a mosquito and had all the symptoms of acute Lyme, as in migraine, rash, a torso rash, and flu-like symptoms for 3 days. So I'd like that to be considered.
Good.
And also, as it's been mentioned, that we don't work in isolation and that we look at other countries and their protocols and policies and their practices. Thank you.
Good, thank you for that. We'll go back into the room. Sir.
My point really deals with the colleges of physicians and surgeons as well. Quickly, when you look at them online, you see lines like regulates the practice of medicine in BC. In Ontario, continuously improves the quality of care. In Manitoba, protects the public as consumers of medical care and promote the safe and ethical delivery, etc. The issue we raised at this table, and I really want to strongly underline it, is that attention needs to be placed on those occasions when the role of the colleges of physicians and surgeons in regulation leads to a detriment of innovation. The two, regulation and innovation, are essential to quality medical practice. A regulation to the detriment of innovation results in stagnation. Innovation without things we've been talking about, like documentation, guidance, this leads to wasted effort. So the innovation with a reasonable degree of innovation with a reasonable degree of regulation, the very tools to collect information, the data, doing it methodically, accurately, comparably. This is where the colleges need to place their efforts and become enablers as well as policemen.
All right, thank you very much. Let's go to the next point. Other idea for consideration. Go ahead, sir.
Yes, thank you, sir. So patients and doctors working together are what will make this solution possible. And one example is like our snacks that we have here. Like from my perspective, I can't have sugar because of antibiotics. So, but anyways, best help available from a patient perspective or from those that are cured from Lyme, because when you have bad symptoms, you can't explain yourself as well and help. So to help this problem ASAP, we need treatment/funding ASAP. So I wrote compassionate loans now for who attended and registered online for the conference. And then, because it was mentioned before about reimbursement, which could happen at a later date, but treatment can't wait. So.
Good, thank you for that.
This tags on well to the comment in the other room about holistic treatment and the sugar comment. In recognition of the importance of nutrition and health of the personal and community microbiome, as part of Lyme treatment, that registered holistic nutritionists and other holistic healthcare providers be considered part of the integrative healthcare team, that the service of these folks be covered by provincial healthcare plans, and that if these plans are not covered by healthcare, that they be tax deductible to the patient. So that would apply to all integrative or healthcare professionals.
Good, thank you for that.
Research for vaccinations.
Yep.
We've had vaccines in the past. No, it wasn't as effective as we would have liked it to have been. There are vaccinations for dogs and other pets who spend their time outdoors. And for those of us who spend our time outdoors, it would be nice to have a vaccination. Thank you.
Good.
Hi, I'd like to see the Public Health Agency do a cost-benefit analysis of treating suspected Lyme or the categories of Lyme that have been mentioned here, even without positive Canadian testing, versus the current status quo.
Thank you for that. Any other ideas?
The guidelines really need to have honest information that doctors can use regarding late Lyme disease and the difficulty in treatment with late Lyme disease. And for that, I'm talking mainly about the fact that current emerging evidence and scientific research is showing, that persistent bacteria does exist. It's, appears to be non-culturable. It's unknown if that's causing, consistent or continuing disease, but it just needs to provide honest information so that doctors can either act on that or, perhaps do some more research themselves and look for the very latest research and decide what is the best approach.
Thank you for that. And over here. And we'll bring the mic to you in a moment.
I think we're doing better with this, but I just want to address the issue with, I'm a Lyme patient as well, and I think we kind of need to start working on stop blaming all of the doctors because they're under the scope of the IDSA and College of Physicians, so even if they want to help, they'd be disciplined. So some of them, it's not their fault. I mean, are there some who, are working for the paycheck? I don't know, maybe. But yeah, so I just want to work on that. And just to specifically mention, maybe at some point working on getting the doctors who have their licenses removed back. So that, because we need them too, right?
Okay, thank you. And over here.
We had talked in the group this morning about how some Lymies who are recovering or are recovered are capable of doing some sort of work, but maybe not the field that they were in previously. And so funding for new learning for them so that they can be employed again. And then I just had the thought about potential jobs that are going to be opening up because of the new framework. Perhaps Lymies who know more about it than the average person on the street could be considered for employment in some of those areas.
Thank you for that. Let me go to, we'll get the mic to other people in the room, of course, but let me go to the WebEx folks to see if there's anyone who has any other idea to contribute.
Thank you. Our next idea is from Catherine Leanne Morgan. Please go ahead.
Yes, hello.
Hello.
My two comments are that we include the agents that attack the biofilm at the same time that we are looking at agents to treat, like herbs and antibiotics. We need to be looking at biofilm. We see that there's a lot of research on it in the States, and we need to pull on that research in Canada so that going forward in our guidelines, we're really looking at that. The other thing is, I'd like to see the World Health Organization have a role, like in terms of educating and leading in terms of the needs here in regard to Lyme and co-infections. Thank you.
Okay, thanks for that idea. Is there somebody else on WebEx?
Thank you. Our next idea is from Doris Owen. Please go ahead.
Thank you. Go ahead.
Yes. 2 points I'd like to make out. One of our leading newspapers here has not had one thing in it about the federal conference going on there, and perhaps some info from that could go to the leading newspapers. And 2, just a point of interest, BC, who says they only have 0.5%, they also had the first raptor bird that was a reservoir for Lyme disease that infected the ticks. And this bird was diagnosed back east, not in BC.
Okay.
It was sent back east. Thank you.
Thank you for that. We're going to be back in the main room, and ma'am, over to you.
I'll just be really brief. The new guidelines should be developed following the Institute of Medicine's standards for developing trustworthy clinical practice guidelines.
Okay, thank you for that.
Okay, I just wanted to state that Canada can take advantage of current, reliable, correct practice guidelines and treatment guidelines that do exist now. There's no need for us to reinvent the wheel with all of this because there are some great, reliable resources already existing that should cut our time down in implementing all of this.
Good. Thank you for that.
So I would like it looked into as to whether we can have a legislative framework for stopping persecution of doctors. Thank you.
Okay.
And I presently have chronic Lyme disease. I can't find a doctor to treat me, and I'm really interested. I wanted to go to this to meet a doctor, maybe who knows something, and maybe even connect with them afterwards. Is there any way to get a list out of doctors who've attended and are interested in trying to help, at least with some of the testing, or, I mean, within the law, who would be willing to see me?
Okay, we'll note that question. We won't be able to answer right away, but we'll note that question, ma'am. And thank you for submitting it. I think we'll have to move on. Those of you who haven't had a chance to express a new idea on guidelines and best practices, please submit them on your way out when we're done today.